Welcome back. You're still watching SA Today on the SABC News Channel, independent and impartial. Cities, provinces and civil society networks have moved to provide shelter for South Africa's homeless during this first week of the COVID-19 lockdown. Médecins Sans Frontières, or Doctors Without Borders, has done an assessment of a few of the shelters that are being provided for homeless people during the COVID-19 lockdown. To tell us about what they found, I'm now joined on the line by Dr. Gilles Van Cutsem, who's a senior TB HIV advisor with MSF. Thanks so much indeed for joining us. What made you want to look at these shelters in the first instance?
Good afternoon. Well, I was requested specifically by the South African Human Rights Commission to participate in an expert investigation of the Strandfontein shelter in Cape Town. Then MSF has also been requested by the city of Tshwane and of Johannesburg to support them in smaller shelters. So those are not specifically assessments. Those are shelters where MSF actually provides some support.
All right, so what have you seen at some of these shelters?
So at the Strandfontein shelter, there are over 1,500 homeless people hosted in a large marquee tent, up to 600 people in one tent, other tents with 500, 200, and then there are tents with smaller numbers. Definitely gross overcrowding and the impossibility to provide adequate social distancing. There is a reason why the national regulations prohibit gatherings of over 50 people. It is because large gatherings of people put people at risk. So that is the most important finding. The second finding is that people have been put in those shelters, some of them requiring specialized medical care. You had people with severe psychiatric disorders, psychosis, schizophrenia. You had elderly, demented people. You had people with drug abuse who were having withdrawal symptoms. You had disabled people. All of them huddled together. So in addition to a danger for their health in terms of acquiring COVID-19, but also in terms of, probably more importantly, TB or even HIV. Putting so many people, mostly homeless people, together is a risk for violence. And there have already been several incidents of violence.
From what you've just told me, it seems that on top of this, there's different kinds of care that's required for some of the people there. And by putting them all into one place, some of them may not be getting the care that they need straight away.
Yes, that is the case, definitely. So the city of Cape Town is increasing the level of care they are providing, but during my last visit, they were still only providing care from 8 to 4, with difficult access to emergency care at night. Right. And there was no monitoring, no health monitoring in the tent. And people are screened at entrance for COVID, but of course you can have COVID and be asymptomatic during the incubation period, and then develop symptoms later on. So there is no guarantee that no one in the tent has either COVID or TB and start spreading. So, yeah, people are actually, there is a risk of doing more harm by grouping these people together than actually leaving them in the street.
All right, so what you're saying is that what the authorities should be doing is having more shelters with less people in them, and also sorting the people into various categories depending on their needs.
Yes, absolutely. I think now MSF is calling for a decommissioning of the big Strassenheim shelter, and then referring people to smaller shelters that are properly resourced to provide sufficient infection prevention and control measures and sufficient care, depending on, as you say, the specific needs of people. So you have people with psychiatric needs in one place closer to a psychiatric hospital that is providing psychiatric care. You can get the same with drug users, people with need for actually respite care. There are people in there with urinary catheters. There are people with fecal incontinence. They actually need to be in an inpatient respite care facility. So yeah, that is what we call it for.
Do you find that the people at these shelters have been given enough education about COVID-19 and some of the safety precautions that they need to take?
No, there was no health promotion material to be seen anywhere, and the different tents are managed by NPOs, not-for-profit organizations, whose mandate is to provide shelter, but they are not they are not medical people, and they also are not providing at the moment, not from what I have seen, health promotion. I think this camp was, I know this camp was set up very, very quickly without sufficient planning, so those things might, of course, still be corrected, and I think the health has the intention to do that, but it is very necessary.
Another challenge, of course, is sometimes with homeless people, they sometimes are forced to look to things like drugs and alcohol. And I wonder if there could also be another problem in terms of just facing withdrawal symptoms for those that are taken off the streets and don't have access to some of these substances.
Yeah, absolutely. That has been one of the big problems during the first few weeks, because you had heroin addicts, people who were taking methamphetamine, you had alcoholics who suddenly had to stop, cold turkey, as they say, and without the necessary medication to actually alleviate the symptoms of withdrawal. So that well, first of all, that is dangerous in terms of health, and second, it creates frustration and distrust in the authorities that are managing the site.
All right, so if I heard you correctly, what you're saying is that a lot of these shelters are so badly aggregated that a lot of these people might be safer on the streets than actually stuck together in these shelters. Perhaps as a final word, what would you say to the authorities that they need to do immediately?
So, I don't want to lump all the shelters together. I have assessed the Strassenheim shelter, which is a very big shelter and which has specific problems. And then we also know that there are other shelters where infection prevention and control measures are not in place. So what I would say to the authorities, first of all, ensure that all the shelters abide by health regulations and have the adequate infection and control and health services in places, and then do not continue with the strategy of creating mega shelters like the Strassenheim shelter and decommission the Strassenheim shelter gradually towards smaller shelters with adequate care and adequate health promotion and adequate infection prevention and control services.
All right. One final question, because I know that you work a lot with TB and HIV, and these people with these conditions are particularly vulnerable. What can authorities do to assist? Because there's some people walking around with HIV and they don't know it, and perhaps their CD4 counts are actually dangerously low.
Mm-hmm. Yeah. So definitely, I mean, in those shelters, you need to protect the most vulnerable for infection, to even take more precautions for those ones. With HIV, the evidence is not clear yet whether there is an increased risk of COVID or not. For TB, there is more and more evidence showing that people with TB or people who had TB are at a higher risk of acquiring COVID, but also of severity and death from COVID. And as you know, TB in South Africa is driven by the HIV epidemic. So there definitely you need, but I think that is already happening, to give advice to people with TB and HIV to follow even more the social distancing, the hand washing, the basic health promotion, but also to make sure that people who have cough symptoms, which might be COVID, but also to go and test for TB, because they need to be, probably at the moment, if you are coughing for a certain time, it is more likely that you have TB that needs to be treated than that you have COVID. Now, this might change in the future, but treating your TB and treating your HIV is actually a way to decrease your risk of complications of COVID. So I would say, and I think the authorities are doing this, increase prevention messages for HIV and TB, and also encourage people today to test for HIV so that they can start antiretroviral therapy as soon as possible and to continue to test for TB.
All right, Dr. Gilles Van Cutsem, thanks so much indeed for joining us and sharing your insights with us. Valuable information indeed. Thanks so much indeed for your time.